Hello everyone, my name is Anne Breen and I'm a physiotherapist working in the community within the adult population here in Brighton in the United Kingdom. Falls prevention exercise has been proven to be extremely effective in reducing falls. It plays an important role in the falls care pathway both in terms of primary and secondary prevention and can significantly contribute to reducing the financial burden on the National Health Service and social care by preventing fractures and avoidable hospital admissions. Audits of falls and bone health services have consistently shown that provision of falls prevention exercise is patchy and often does not follow the guidelines for evidence-based practice. This short podcast briefly highlights the research and evidence behind falls prevention exercise to give a better understanding of the kind of program that have been shown to be effective in preventing falls. It also provides examples of evidence-based programs that are currently in practice in the community. The learning objectives are to review the evidence-based recommendations and apply these to therapeutic exercise in falls prevention in the geriatric population, and review and understand the specificity of falls. Falls and fractures in people aged 65 and over account for over 4 million hospital bed days each year in England alone. The healthcare costs associated with fragility fractures is estimated at 2 billion a year. Injurious falls, including 70,000 hip fractures annually, are the leading cause of accident-related mortality in older people. After a fall, an older person has a 50% probability of having their mobility seriously impaired and a 10% probability of dying within a year. Falls destroy confidence, increase isolation, and reduce independence, with around 1 in 10 older people who fall becoming afraid to leave their homes in case they fall again. A tailored exercise program can reduce falls by a number of randomized controlled trials have evaluated the effect of exercise as a single intervention in the prevention of falls in the community setting. What are the types, frequency, and intensity of physical activity that are most effective in reducing the risk of falls in older adults? Exercise, which has a focus on balance training, has the greatest effect on falls. The most effective component of a multifactorial intervention is therapeutic exercise, as balance impairment and muscle weakness caused by aging and disuse are the most prevalent modifiable risk factors for falls. Programs of at least 2 hours of exercise per week for 6 months or more are more effective in preventing falls than lower dose programs. Walking or strength training programs as single interventions do not appear to prevent falls. More active people experience fewer falls, but there is no evidence that we can prevent falls by simply encouraging. What are the most effective programs for delivering these recommended types and levels of physical activity? Falls can be prevented by a range of exercise programs which target balance and provide ongoing exercise. These include the Otago exercise program of home-based balance and strength training, Tai Chi, group balance exercise, and strengthening exercise programs. Programs should be designed according to the needs of the target population to ensure they provide exercise that is challenging yet safe. Programs must be tailored to the individual in order to be effective. It must be pitched at the right level and enable participants to progress, and must also take into account medical conditions and falls history. Tai Chi, for example, will be effective for those who have not yet fallen and have mild deficits of strength or balance, and is less effective for those who have fallen and who are frail. Actually, the performance of these exercises could cause this population to be at a greater risk as they are not able to safely perform those three-dimensional unsupported movements of Tai Chi, or they could risk that these exercises become adapted to seated exercises, which will not reduce the risk of future falls. Despite studies showing a decrease in falls and improvement in the quality of life and significant cost savings, older people continue to have limited access to evidence-based falls prevention programs. Where these programs are available, the vast majority are altered or scaled down to an average duration of 12 weeks or less, whereas we know that a dose of at least 50 hours is necessary to reduce the falls. So Tai Chi has been proven to reduce the risk of falls of mild deficits in strength and balance, and for people who have not yet fallen, who have had no falls. However, Otago and Postural Stability Program have shown to be effective in falls prevention by 35% and 54% respectively, and are appropriate for reducing the risk of falls in older people. Chair-based exercises and walking, however, have not shown to be effective evidence-based. The NICE guideline on the assessment and prevention of falls in older people is clear that strength and balance training is a key component of successful multifactorial intervention programs. The need has never been greater to ensure that resources are targeted where they are most effective. The thought questions I'd like to leave you with are specific types of programs more likely to be effective with particular population subgroups, such as people aged 85 and over, and people with chronic disease, and people from culturally and linguistically diverse backgrounds? And what does the evidence suggest would be best for community-based programs and residential aged care programs? Dual tasking, and what is the connection between dual task capacity? We need to remember that there needs to be an appropriate rationale behind what we build. Here are some references for you. Thank you for your time, and I look forward to the discussions and feedback.